Hello, everyone, and welcome to my channel. I am Molinda Jae, and I'm here to talk about sepsis awareness. As of this year, I just now found out that September is Sepsis Awareness Month. Um, Due to the fact that my grandfather had and a couple other family members have experienced sepsis in regards to their health, which caused them to transition. So I thought about, okay, since we've seen this time and time again within our family members that have suffered through it, why not just continue on and spreading awareness about it? So luckily, I'll just besides the breast cancer awareness month for October, and then the March of Dimes that's happening earlier in the year, and so forth, and all the other awarenesses. I really want to take interest in definitely raising more awareness when it comes to sepsis, because it affects the lower region, to where your body is basically shutting down at that point. um and it's only a matter amount of time before you begin to transition into the internal sleep. So without further ado, let's get into it. Of course, the reasoning for the colors that represents sepsis awareness month is red and black. um of course, red is associated with the blood, and leaning towards when it gets to that sepsis part, that's when the blood goes into red, goes from red to black, because again, that's when the body starts shutting down. It slowly starts to shut down. So, for with the table of contents, we're going to be discussing the introduction, what is sepsis, the four types of sepsis, the symptoms of sepsis, and of course, the conclusion. And I'm also going to be going back and forth with an article, as well as how you can definitely go into detail and continue to raise awareness in regards to this disease. Okay, so the introduction of sepsis is, what is it? Sepsis is the body's extreme response to an infection. It is a life-threatening medical emergency. Sepsis happens when an infection you already have triggers a chain of reaction throughout your body. Infections that lead to sepsis most often start in the lung, urinary tract, skin, as well as gastrointestinal tract. Tract. And this is coming from the CDC.gov. Now, if you go to the CDC.gov link, or you just look it up and you just press on link, it has been archived. So, however, you can still read up on it, and there's other sources that I'll also explain further along in the presentation. Also, with sepsis, is the body's life-threatening response to infection that affects 1.7 million people and takes 350,000 adults' lives in the U.S. every year. Okay, and that is coming from the sepsis.org website, which I will be bouncing back and forth within this presentation. Now, the four types of sepsis, and this is coming from the NIH.gov website, where a team had tested the machine learning the approach on second set of electronic health records for more than 43,000 sepsis patients treated in 2013 through 2014. Again, they found four types of sepsis with similar clinical characteristics, such as the first one is 29% for alpha, 29% for beta, 28% for gamma, and 14% for delta. And this is the portion where it talks about the prevention. So let me go ahead and switch back over here right quick. Now, this is coming from sepsis.org. As explained within this website, please keep in mind this is for entertainment purposes as well as research and educational purposes as well. What is sepsis? And Alex explained, it says sepsis is the body's overwhelming and life-threatening response to infection that can lead to tissue damage, organ failure, and death. In other words, it's your body's overactive and toxic response to an infection like strokes or heart attacks. Sepsis is a medical emergency that requires rapid diagnosis and treatment. Sepsis can lead to severe sepsis and septic shock. You may have heard the term blood poisoning instead of sepsis. Blood poisoning is not an accurate description of sepsis. You can learn more about sepsis and blood poisoning here. So let's go ahead and see what that pops up. So for blood poisoning, we might as well do it while we're here, right? Blood poisoning is a common term sometimes used incorrectly to describe sepsis. A doctor or nurse may say blood poisoning because it is a term many people are familiar with. But blood poisoning is not an accurate description of sepsis, and the two terms should not be used interchangeably. Sepsis is not an infection of itself. Sepsis is the body's life-threatening response to an infection like strokes or heart attacks. Sepsis is a medical emergency that requires rapid diagnosis and treatment. Sepsis and septic shock can result from an infection anywhere in the body, such as pneumonia, influenza, or urinary tract infections. Worldwide, 1/3 of people who develop sepsis die. Many who have survived are left with life-changing effects such as post-traumatic stress disorder like PTSD, chronic pain, and fatigue by organ dysfunction. Organs don't work properly, or amputations. What happens with sepsis? Scientists are working on discovering what exactly happens in sepsis. We know the inflammatory response causes problems such as internal blood clotting, too much and too fast. This means that parts of the body don't get adequate blood flow and the body's tissues don't get the nutrients they need. The signs and symptoms of sepsis vary widely and can cause organs to fail, requiring life support. While we still don't know why our bodies react this way, we know what sepsis can cause, such as leakage from lining blood vessel linings, much like water hose with holes in it, low blood pressure like hypotension, because if it was high blood pressure, it'll be hypertension, with reduce of blood flow to vital organs, small clots through the body that prevent nutrients from reaching vital organs. These changes causes a person's organs to stop working in many cases. Some of the signs include heart. With the heart, low blood pressure, fast pulse. With the lungs, low oxygen level, problems breathing. Kidneys, making very little urine. Brain, confusion, coma. Okay, so if there's a medical emergency, you have any reason to suspect sepsis, it is essential that you seek medical help immediately. If you suspect sepsis, call 911 or go to a hospital to tell your medical professional, I am concerned about sepsis. That is the key phrase. If you are seeing if you are suspecting sepsis, that is a lot of S's within this presentation. But again, that is what you need to specifically tell a medical professional is, I am concerned about sepsis. Because when it comes to sepsis here, which is this prevention here, or just something to look out for, is about time. Watch for time, temperature, infection, mental decline, extremely ill. And of course, the citation for this is Sepsis Alliances, Sepsis and Blood Poisoning, as well as sepsis.org with blood poisoning. Now back to the other part. Your immune system usually works to fight any germs, bacteria, viruses, fungi, parasites to prevent infection. If an infection does occur, your immune system will try to fight it. Although you may need help with medications such as antibiotics, antivirals, antifungals, antiparasitics, however, for reasons researchers don't understand, sometimes the immune system stops fighting the invaders and begins to turn on itself. This is the start of sepsis. So when you feel like the body is turning against the invaders, that's when you need to look out for these signs. Some people are at higher risk of developing sepsis because they are at higher risk of contracting an infection. These include very young infants, very old, with those with chronic illnesses, and those with weak or impaired immune system. People who are malnourished can also contract infections more easily as well. Patients are diagnosed with sepsis when they develop a set of signs and symptoms related to sepsis. Sepsis is not diagnosed based on an infection itself. You have more than one of the symptoms of sepsis, especially if there are signs of an infection or you fall into one of the higher risk groups. Your doctor will likely suspect sepsis, okay? Sepsis progresses to severe sepsis when, in addition to signs of sepsis, there are signs of organ dysfunction such as difficulty breathing, problems with lungs, low or no urine output, kidneys area, abnormal liver tests with the liver portion, and changes in mental status with the brain. Nearly all patients with severe sepsis require treatment in an extensive care unit, ICU. Septic shock is the most severe level and is diagnosed when your blood pressure drops to a dangerous level. Sepsis is the number one cause of the hospitalizations in the U.S. Costs for acute sepsis hospitalization and skilled nursing are estimated to be 62 billion annually. This is the only portion of all sepsis related costs, since there are substantial additional costs after discharge for many. The average cost per hospital stay for sepsis is double the average cost per stay across all other conditions, and sepsis is primary cause of readmission to the hospital, costing more than 3.5 billion each year. Studies investigated survival and sepsis death have reported slightly different numbers, but it appears that on average, approximately 30% of patients diagnosed with severe sepsis do not survive. Up to 50% of survivors suffer from post-sepsis syndrome, which that could be another video in itself, until a cure for sepsis is found. Early detection and treatment is essential for survival and limiting disability for survivors. And of course, on this website, it does have a sepsis video, which you all can check it out. And I'll leave the link in the description box below. And it also provides you a sepsis fact sheet as well that you can download on your leisure as well. The time when it comes to sepsis, remember, it's about time. Watch for temperature, higher or lower than normal pressure, higher than normal temperature. Infection, look out for signs and symptoms of an infection. Mental decline, person may experience confusion, sleepy, or difficult to arouse, as well as extremely ill. A person may experience severe pain, discomfort, as well as shortness of breath. So please be on the lookout for that. Time is definitely essential. And as far as like the conclusion of this, it is time to raise more awareness. Well, my thoughts about this is that it is definitely time and more prominent than ever to raise more awareness about sepsis, so we can be able to be more vigilant of the signs and get professional help when it's time. And of course, there are the sources that I've did some research on it, as well as read off of at my leisure and during this presentation. But I just thought I would bring this attention to you all to whenever September rolls around again next year, is to, of course, show your support and continue to raise awareness on sepsis, because me personally, it has affected a lot of family members, and old sage, the elderly in my family, to where me and my family had to, of course, go with the flow and assess and help with our relatives in regards to recovery and sending them on to glory in a peaceful manner than be dying in vain, so to speak, if you catch my drift. Okay. Which that'll be a whole nother video in itself. But I thought I would bring this attention to you all, as to, if you or someone around you are experiencing some type of symptoms in some form of way, it is definitely more prevalent now to be able to act fast, because time is definitely in the works, and it's very precious, to where it could cause some damaging and fatal effects. Okay, so I'm going to end it on this. And of course, I thank you all for tuning in. Yes, there we go. Thank you all for tuning in. Leave a comment down below of your thoughts and opinions about this presentation. Again, the awareness colors for sepsis is red and black, due to the fact that the color of the blood is red, and as the body is shutting down and turning its back against you, it will go into the color of black, due to the fact that it is shutting down slowly but surely. Okay, and all my social media links will be in the description box below, so please be sure to check those out. Share this video so we can all each one and teach one and be aware of the signs as needed. Be sure to like the video and subscribe to the channel if you haven't done so already as well. So of course, I can continue on raising awareness in any shape or form I can. And don't forget to hit the notification bell so you know the next time I upload a video. And don't forget to click all so you'll know, definitely know. Okay. So you'll definitely know the next time I upload a video. And always remember to love thyself, know thyself, soothe thyself, so you can heal thyself. And I'll see you guys in the next video. Bye.